I want to know what we can do as a sleep field, as a sleep patient community, to get the word out there, the right information out there, because there's a lot of misinformation out there.
One question that you had raised in writing that I would like to make sure we do address here.
Yeah, absolutely.
Is the question of increased risk to those around you when you are using your CPAP. So to address that, I would point out that most ventilators that are used in a hospital today are so-called dual circuit or closed circuit ventilators. That is, the patient is on one end, and then there are two tubes that go back to a ventilator.
Right.
So the inhaled air goes in one, and the exhaled air goes out the other, and gets captured, filtered, and usually goes through a CO2 absorber if it's used in the operating room or that sort of thing. Whereas most CPAP is single limb. The air comes in to the patient, and then from there has to be a leak. When you exhale into the mask. In the older style, the air goes down, the exhaled air goes down the tubing, and then the forward flow pushes it back out through a leak that's put in somewhere into the tubing. Right. With more modern masks, the leak is built into the mask very often. Right. In this particular model, the leak is built into a valve. So the valve here that is going into the mask has the leak built into it. The mask is airtight. This little leak that's right here, everything you breathe out goes out that leak, plus all the extra air that's blowing in to wash the carbon dioxide out of your mask, because you don't want to rebreathe your own carbon dioxide. So this becomes a forceful jet of air that is absolutely packed with infected particles. Where we talk about a 3-foot or a 6-foot radius, a patient wearing one of these probably has a 30-foot jet. And of course, a sneeze or a cough can cause air to travel that far. You can see it easily with an infrared camera. Right. But this is what's freaking out the nurses when patients come in and they're sick, but they're not yet requiring ventilation, and it's night and they want to put their CPAP on, and the nurses don't want that because they feel now this stuff's blowing right at my face. It's going to get in the little cracks behind my mask. Or you may be at home and being told to quarantine. Maybe you're the only one who's been told to quarantine. What do you do about your family? Are you going to wear this thing or not? So these are questions we don't have good answers to. I do think that if you put some sort of fabric collector around this, 2 layers of pillowcase or something, the particles will be trapped in there. The air will come out and will be no worse than your normal exhalations.
Would you be worried about still trapping the CO2 in that extra bag or that extra layer?
No, these vents are one way. They only allow, unless you overpower it, you cannot breathe in through this. You can. There's a built-in, if let's say it got blocked down here, then you would breathe in hard enough, you could pull air in through there. But generally speaking, that's not going to happen.
Great.